Well, hi everyone. This is Dr. Tami. My full name is Dr. Tami Moralia, but I'm married and Italian, and nobody can remember my last name, so I go by Dr. Tami. I'm a double board certified MD and a best-selling author of a book called The Hormone Secret. Very exciting. It's coming out in paperback really soon, so you can watch for that, about hormones. But the thing that is the most exciting to me that I do is my work as a stem cell surgeon. I'm very blessed to be part of the only national clinical trial that is registered with the FDA for stem cells in the United States. And this is a clinical trial that is patient funded. So the good thing is that if you meet the criteria of being entered into this clinical trial, that you're able to have this treatment. You don't have to meet any strict criteria. The criteria is that you do not have an active infection or that you do not have cancer. And other than that, you can get stem cells. So I want to tell you a little bit about stem cells. I want to tell you what they can and can't do. I want to talk about the difference between placenta, amniotic, and fat and bone marrow stem cells. And then I'll tell you some of the stories that we've been seeing in this clinical trial. And so, first of all, stem cells are repairing cells, rejuvenative cells. They can become anything in your body. So they're stored in many places, but it turns out that there's a plethora of them in your fat. And we'll go into later why fat is such a great source for these stem cells. Stem cells have been used for decades, and there's a ton of research both in the United States and abroad, but it really hasn't entered into mainstream, and it's not FDA approved yet. That's why we're doing the clinical trial, and it's also not available with your insurance and things like that. But the results and the exciting things about this are utterly amazing. Stem cells can treat things like orthopedic. For example, my husband, he was told by several orthopedic surgeons that he needed to have a shoulder replacement. Well, he's young, and shoulder replacement surgeries are often unsuccessful, and there's a lot of physical therapy and downtime, and so he wanted to see what else he could do. So we did his stem cell treatment, and he is pain-free, full range of motion, and no surgery. So how exciting that our own cells can be the reservoir of healing for all these things. We do other orthopedic conditions, neck pain, back pain, knees, ankles, hips, just your aches and pains that somebody said to you, you know, you really ought to consider a knee replacement, but you're too young. So then what do? You stop playing golf, you stop going running, you change your life, but you don't have to. The exciting thing is that stem cells can treat these. And with the orthopedic conditions, oftentimes it's one and done. So it's wonderful. We treat this, it rejuvenates to your tissue, your cartilage, your joint space, and decreases your pain and gets you back to your life. Other conditions that we treat successfully and have had great results were heart conditions, cardiomyopathy after a heart attack, stroke, brain injury. Oh my goodness, the brain injury studies are amazing. Traumatic brain injury, stroke, and then some other brain injuries or brain conditions like Parkinson's and MS. Autoimmune conditions can be really well treated with this. There's so much COPD, emphysema, asthma. There are many, many, many things that we know are successful, and also many things that we're learning as we go along, that stem cells can really be used to heal and rejuvenate your own body. So let me tell you kind of how it works. So after we've assessed that you've been a good candidate to receive your stem cell treatment, you'll come to my clinic in Seattle, and it's about 3 hours that you're going to be with us. There's about a half hour, 45-minute procedure where I'm going to remove some of your fat. And we do that under a local lidocaine, so I'm just going to numb up the area. And then after that, you can go for a walk, you can have lunch, you can watch a movie, but we've got about an hour to an hour and a half with your cells, and we want to process, isolate, and concentrate them. Then we're going to give you an IV of your cells right then and there. And then if you have an orthopedic condition, we might put into your knee. And if you have COPD, might also give it to you nebulized. That's like a breathing thing here. So there are all kinds of ways that we can deploy it, but every single person gets IV. And in the early part of our study years ago, we tagged the stem cells, and this has been done before, and we imaged people and watched where the stem cells went. And it was fascinating. It turns out that stem cells have a homing device. They actually know where to go based on an inflammatory cytokine pathway and chemical messages. So we see people that have their right knee lit up, but not their left knee. Everybody's stem cells go to their lungs first and hang out there for a little while, but then it kind of goes where it's needed. We also have really powerful animal studies for the brain injury. We have safety papers and an ongoing traumatic brain injury where we have these rats that have been given a concussion, and then the rats that received stem cells have no deficit. And compared to the rats that did not receive their stem cells, those rats are doing the maze worse and worse, up to 3 months later. It turns out that people who get a brain injury, the results of the brain injury and the injury itself continues to get worse months and months later. It's not just a one-time event. So what a wonderful thing. We actually have a vet who's coming to do a procedure here with us. He lost 3/4 of his leg and had a traumatic brain injury. And he's actually on the Olympic powerlifting team. He's decided that he's going to seize his life, but he's really wants to help his brain. He really feels the effect of his brain injury. And so we're going to treat him, and we'll be able to show you on our website, which is seattlestemcellcenter.net, a video of his interview and his procedure, and then we're going to be following him after. So exciting. So after your IV, you're good to go. Now, we don't want to be a drive-by stem cell clinic. You know, stem cells are a little bit like the wild, wild west right now. There's clinics that are registered with other agencies. We're the only one that is registered with the FDA. And then there's clinics that are just doing their own thing, you know, not following any guidelines or safety. They're just trying things out and doing the best that they can. The reason that I love being part of this clinical trial is, though I don't think the FDA is this super high gold standard of everyone and everything, you know, how many medications have been FDA approved and then recalled later. But at least an FDA registered trial has to meet a certain safety. And it also has to be done the exact same way, so that when you are hearing that there's an 80% success rate with an orthopedic condition or a 60% success rate treating MS, you know that you can trust those statistics because we've done over 5,000 cases the exact same way. We have to register it with the FDA. So I think that's really reassuring. To date, in our 6th year, the exciting thing about our stem cell treatments is that no one has ever gotten worse. Unfortunately, it doesn't work for everyone. That's why we're doing the clinical trial. We don't know why. But it's one of those things that there's no surgery, there's no medication that can say, we have yet to see that this has any negative side effect. No hospitalizations, nobody had gotten their condition worse. It's very, very exciting that, you know, the worst case scenario so far is that it doesn't work at all. And unfortunately, we don't have anything in medicine yet that works 100% of the time for 100% of the people. So you're going to be with us. Now, what we also do is we give you a complementary functional medicine analysis. We want to make sure that we're dropping your inflammation and digging into your nutrition and your lifestyle and looking at your hormones and things that we can do so that the stem cells have their best opportunity to do the most amazing work. And all that is included. You don't have to pay extra for that. Normally it's $400 or $500 for all of this assessment, and that's just included. I have a secret desire that when the results of the studies are all published and they look at all the centers, I hope that when they look at my center, they're going to say, like, gosh, why did this person have such great results? And it'll be because I'm adding all these extra things and really trying to bless people's lives. So let's talk a little bit about amniotic, placenta, bone marrow, and fat. So there are all these that are available. And placenta and amniotic stem cells are wrought with an ethical and political issue. We chose not to address or use the stem cells from amniotic or placenta for that reason. But additionally, there was found to be a very small risk that was increased in tumor and cancer formation. Now, it wasn't huge, but we just wanted to stay away from that completely. Plus, it's wonderful that there's no rejection, no reaction when we use stem cells from your fat because it's from you. Now, let's talk about bone marrow. And bone marrow is a great source of stem cells. And if you are young and healthy, your bone marrow is just as good as your fat. But what we have found is that your bone marrow stem cells lose their potency if you have a chronic condition or if you're getting older in your 70s or 80s. Now, if you had a condition that I couldn't quite figure out, like a blood condition or something, I'd actually do a bone marrow aspiration as a doctor to diagnose your condition because your illness will show up in your bone marrow. So the last reason we chose not to do bone marrow is that it's a horrendously painful procedure to remove bone marrow. And the results of the fat-derived stem cells was just as good. And so why would we do something that was so horrendous? Our goal with this study is to provide a bedside procedure that's going to be available everywhere in the United States, just as an office procedure. And that is much more easily done if we do it from fat. Besides, nobody ever minds donating a little bit of fat. We take it from your love handles usually. I take 50 cc's, so that's about 1.5 ounces. So it's not much, but still nobody minds donating that. The exciting thing is that not only can we get your stem cells and we can treat your condition right then and there, but we can also do an additional harvest or just do a harvest on its own if you're young and healthy, and we can bank your stem cells. This is true biohacking. This is true bioinsurance. Can you imagine being young and healthy and storing your stem cells? Because you know what? Nobody plans to blow their knee out. Nobody plans to have a traumatic brain injury, a stroke, or a heart attack when they get older. And if you have your own stem cells that have been sort of frozen in time and are the best that they could possibly be, because let's face it, your stem cells today are as good as they're going to be. Next week, they're a week older. Even though we have great results with patients in their 60s, 70s, and 80s, it's still, we want to do this as young as possible if we can, because we assume that the stem cells are even better when you're younger. We have been given authorization to replicate and grow your cells. Now, this is an uncommon thing in the United States, so we're really excited about not only can we store your cells, but we can double, triple, or quadruple the quantity, and you can get them given to you when you need it. And some people are actually getting it as an anti-aging treatment done once a year, just to repair any unknown things that are going on in your body. Now, again, we don't know if this is truly happening. We're doing this study literally to find out the pathophysiology and the methodology of how this is occurring. But how exciting. And your cells are stored in the United States. That's an important piece. You don't want your biologic material in international countries and having to do the safety of that. So pretty exciting ways of using your fats and donating your fat to heal your own body or to create a bioinsurance for later on in life, or as an anti-aging. Now, some of the things that people ask me frequently is, what do I do to prepare? It can get your body to be even better. One of the things is that you can take vitamin D. You can get vitamin D, anywhere. Make sure that you know that vitamin D can be toxic if it's taken too much. So make sure you're not taking too much. But vitamin D seems to help as well. I do have a chat box here. So if you're with us live here, feel free to send me your questions. I'm happy. I can go on and on and on about stem cells. I love stem cells and what they do for the body and educating people. But I'm here to bless your life. So if you have a question, shoot it on in for me, or you can email us later and I can respond via email. I want to make sure you get what you need out of this session and that you know what you want to do with stem cells or not. So the stem cells it's like a revolution. It really can treat anything and everything, possibly. Some of the questions that I get is, besides what can I do to prepare my body, is there anything that it won't help? Yes, that is absolutely possible. If you have something that is very esoteric, or I have a lot of consultations, we offer a complimentary consultation so that you can learn and talk about your condition with me to see if you're a good fit. And I can tell people that yes, we can treat you unless you have cancer or active infection, but there are a lot of conditions that I can't give you statistics about the success rate. So we're literally doing the groundwork for the statistics. We're literally paving the way. Kind of feel like they must have felt when penicillin was discovered. Really changing the future of medicine and what is used to heal the body. Now, there are some things that are exciting uses, but not so medical, and that's the cosmetic use of stem cells. Stem cells can be used to rejuvenate anything, including your skin. Now, some people will advertise, you'll see online that it's stem cell, and when you dig a little bit deeper, it's stem cell from your blood. Now, that's not technically a stem cell treatment. There are stem cells in your blood, but that treatment is called PRP, and I've used PRP for over a decade. It's a wonderful treatment, but it is not the richest and most robust source of stem cells in your body. And so PRP does not have the same outcomes and results as true stem cells do. And so that's really exciting. The other thing is that it's stem cells, but there's so much more. It's actually technically called stromal vascular fraction. And that's because with the stem cells are growth factor buddies and progenitor cells and all these other cells that help grow and contribute to the rejuvenation of your body and tissue and condition. So that's really, really exciting. Make sure that you're educating yourself about whether or not you're getting a quote or information about PRP or a true stem cell or stromal vascular fraction treatment. The other thing I've had people ask me about is that can we get stem cells from animals? Well, yes, we actually treat animals with their own stem cells. We have a rat study right now and it's their own. But we don't want to use the stem cells from animals on you. We don't have to. We don't have to risk the rejection or the reaction. We want to just use your stem cells. I've also heard of a study that is using stem cells from cadavers, which are dead bodies. There's no evidence that those are still living and viable cells. So we're literally counting the number of stem cells and checking the viability before we put it back into your body. So it's really, really exciting. Your stem cells for your treatment are removed from your fat. And again, that's about a 30-minute procedure. Really exciting. The other question I get sometimes is, how does this differ from prolotherapy? People say, well, I had prolotherapy for my shoulder, I had prolotherapy for my knee, it worked really, really well. Well, prolotherapy can be really, really effective. It is not stem cell. It's painful. The whole purpose of prolotherapy is to create an inflammatory response. Stem cells are the exact opposite. In fact, after you have your stem cell treatment, there's usually a honeymoon period of a few days where you have a boost in your energy, your pain goes down, and you feel like, yay, this was a miracle, it worked. That doesn't happen to everyone, but to the people that it does happen, it often wears off. And the reason is that it's happening because stem cells are the opposite of prolotherapy. They're extremely anti-inflammatory. The real time period that you should expect your stem cell therapy treatment to be shown is between 2 and 4 months. And that's because most of the cells in your body have a life cycle about 3 months. They sort of are born and die within a 3-month period. So when you have stem cells, it's going to take 2 or 3 months for your new cells to be born and start functioning at this new level. So we tell people, wait to 2 to 4 months before we say whether or not it did or didn't work. So that's pretty exciting. The other thing that I get asked a lot is, what happens afterwards? Do I have to take off work? Do I have to work out? Stop working out? What's the downtime? Well, you're going to be a little bit sore because I did manual liposuction. Traditional liposuction for cosmetic reasons uses lasers, and so we can't use that methodology because it damages the stem cells. The laser, the ultrasound, the heat, all of that damages the stem cells. So it's actually a manual liposuction. I'm not very big, but I'm able to do it. It's not that hard. Fat is soft, and so you're going to be a little tender in the flank area, your love handle area, from me just kind of going in there and getting your fat out. You're going to be bruised, and after that you can go to your regular activities. We don't want you to fly home until the next day because we've expanded your tissue to remove the fat, and we want that to go back down, and when you fly, it expands your tissue again, and that might cause some problems. So you can go home the following day and you can go back to your regular activities. Now, regular activities. I don't want you to start training for a marathon. I don't want you to start lifting weights. I don't want you to do, intense workouts or things like that. But you don't have to miss another day of work. You don't have to stop walking or doing light workouts. So you just go back to regular life. So that is pretty exciting. One of the things that I want to make sure everybody understands in this time that we have, because we're getting close to the end, is that your body is such a resource of healing. And we're just beginning to realize that if we're able to isolate these things, and it's done in a way that is reproducible and safe, our procedure is very, very unique. It's a closed system, which means from the time I've taken your fat out to the time I put your stem cells back into you, it's in a device. Never seen the air, never exposed to any contamination or infection. So this has turned out to be an extremely safe procedure, and as an MD, I think that that's super important. The other thing is that there's no downtime. Surgery and things like that often have downtime. The risk of your condition being even worse with scar tissue and things like that. The last thing is that, it's you. You have the opportunity to store and save your stem cells for future use, or to use it as anti-aging. Stem cells are just beginning to be understood. It can affect our brains, our eyes, our skin, our heart, our lungs, our bones, our tissue, autoimmune conditions, cellular activities, nervous system, MS, conditions that we thought were just hopeless. My father was one of my first patients. He has COPD, which is a lung condition, and he was on 5 liters of oxygen, and when he would walk, his oxygen level in his body would go down into the 80s. And he had an appointment with his pulmonologist after his stem cell treatment, and his oxygen level was 3 liters, not 5, when he was walking. And at 10 minutes, his oxygen level was still 95. Now I have a lot of patients who send me thank you cards and just expressions of gratitude that they're not in pain anymore, that their function and their balance and their brain and all these things are working very well and have improved. Some unfortunately say that it didn't work at all, and we're working hard to figure that out. But I love data like that. 95% oxygen saturation on 2 liters less oxygen is just black and white. The MD in me just loves this kind of objective data, showing that this isn't just all in our heads. This is truly transformational medicine. So I wanted to thank you for your time. If you've joined us and have any last minute questions, just jot it in if you can. If not, why don't you reach out to us for a complimentary stem cell consultation? You can do that by calling 877-8-VITALITY. That's 877-8-VITALITY. Or you can email us. Tell us a little bit about what's going on with you, and we can start the conversation that way. And the email address is support@SeattleStemCellCenter.net. support@SeattleStemCellCenter.net. I look forward to seeing if we can bless your life and give you more information about your personal situation and how this might be a good fit for you. So thank you for sharing this morning with me. I'm blessed to be part of this transformational journey in many people's lives, and really, truly, I feel like I'm participating in changing the future of medicine. So in ending, I want to remind everybody that you can be the CEO of your own health, and stem cells can be part of that. They're your cells, and it's your body, and so let's use them to heal you. Thanks so much. Have a beautiful day.